Okay, good morning. Bienvenue. Merci d'être ici ce matin. Thank you for being here this morning, everybody. To begin with, we would like to acknowledge that this is a virtual press conference with participants across the country, and it is taking place on unceded Indigenous lands. Our communities are historically known as gathering places for many First Nations, and today they are home to a diverse population of Indigenous and other peoples. We respect the continued connections with the past, present, and future in our ongoing relationships with Indigenous and other peoples within our communities. A few housekeeping notes before we get started with today's press conference. There will be time for media to ask questions at the end, and to do so, please use the raise hand function at the bottom of the screen, and we will unmute your microphone for you. Pour demander des questions à la fin, s'il vous plaît, utilisez la fonction pour lever votre main. And with that, I thank you again for being here, and we will now get started.
Good morning, everyone. Thank you for joining us. My name is Ellen Cohen, and I'm the co-chair of the Canadian Alliance on Mental Illness and Mental Health, known as CAMIMH. In my day job, I'm the national coordinator of the National Network for Mental Health, which represents a community of people living in Canada with lived and living experience of mental health issues. I'm joined by Glenn Brimacombe, who is the chair of the CAMIMH Public Affairs Committee and is the Director of Policy and Public Affairs at the Canadian Psychological Association, which is the national voice of psychology. I'm also joined by Sally Guy, who is a member of the CAMIMH Board of Directors and the Treasurer, who is also the Director of Policy and Strategy with the Canadian Association of Social Workers, which is the national voice of social workers. Today, CAMIMH is here to call on people living in Canada to speak up and say, there is no health without mental health. If you break your arm, you know you'll get the right care in the right time frame. But what about if you have a mental health or substance use concern? There may not be accessible or appropriate services in your area. There may be a wait list for months or more, or you may not be able to afford to pay out of pocket. I think we all know someone who has felt failed by the mental health or substance use systems in Canada. At CAMIMH, we believe this is just not right or fair. We are delighted that this Parliament's throne speech promised to focus on mental health in the same way as physical health, and it's time for the federal government to act on this promise. We need parity between mental health and physical health. To do this, we are asking all people living in Canada to join us and sign a mental health parity pledge, which we will be automatically forwarded to their member of parliament to say they think mental health is just as important as physical health. This way, MPs will know where people living in Canada stand and that they want to see governments provide a better mental health future for all of us. Increased access to evidence-based mental health and substance use health programs, services, and supports, improve publicly funded access to mental health and substance use health programs, services, and supports across Canada, especially in the wake of the pandemic, which has been so hard on all of us. And in light of the ongoing opioid pandemic, the time is now to improve publicly funded access to mental health and substance use health programs, services, and supports across the country, and we cannot wait. To sign the pledge, visit our website at www.camimh.ca or find us on Twitter using our acronym at CAMIMH or on Facebook. Glenn will provide more details about CAMIMH's plan for the mental health parity in a moment. But just quickly, I want to add a bit more about CAMIMH itself and why we're positioned to help the federal government chart a new path. Founded in 1998, CAMIMH is the national voice for mental health in Canada, comprised of 13 national organizations that represents both points of the mental health. People with lived or lived experience, family members and caregivers, and mental health and substance use health care providers. Over to you, Glenn.
Good morning. Clearly what we're doing now isn't working. Even before the pandemic, survey after survey showed that the collective mental health of Canadians has been in decline, with a segment of the population using substances like alcohol, cannabis more frequently. We need the federal government, working in partnership with the provinces and territories, to play a national leadership role and take legislative action to make sure that Canadians that seek treatment for mental health and/or substance use health issues have the same access to care as other issues. And this is what we mean when we say parity. In the view of CAMIMH, it is well past time for those with mental health and substance use health issues to come in from the cold and no longer be treated as an orphan of Medicare. CAMIMH believes that the best way to do this is to pass a new piece of federal legislation called the Mental Health and Substance Use Health Care for All Parity Act. More on that in a moment, but first a little bit more on the pledge. In asking Canadians to sign a mental health parity pledge, CAMIMH is building on the historic momentum that was generated prior to and during the September 2021 federal election. All sitting national political parties identified mental health as a public policy priority. For this, we applaud them. And now we ask Canadians to help take the federal government across the finish line and implement their platform commitments. This is also clearly welcomed at a time where 42% of Canadians believe the pandemic will have a lasting impact on their mental health. Among the commitments that were made, the sitting government promised the establishment of a Canada Mental Health Transfer with an initial investment of $4.5 billion over the next 5 years. A key question will be how best to invest these funds that will have maximum impact in terms of improving and expanding access to mental health programs, services, and supports. For too long, mental health and substance use health programs, services, and supports provided by psychologists, social workers, psychotherapists, and counseling therapists and counselors have not been covered by provincial and territorial health plans. This must change. While the delivery of publicly funded healthcare is the primary responsibility of the provinces and territories, CAMIMH believes there is a crucial role for the federal government to play a national leadership role. In June 2021, CAMIMH released the report From Out of the Shadows and Into the Light, Achieving Parity and Access to Care Among Mental Health, Substance Use, and Physical Health. This recommended that the federal government, similar to other developed economies, pass a new piece of legislation called the Mental Health and Substance Use Healthcare for All Parity Act. The act would provide an accountable legislative framework to collaborate and support the provinces and territories to improve timely access to evidence-based mental health and substance use healthcare for those in need. It would recognize the importance of investing in health promotion, prevention, and education, and the social determinants of health. You can find this document on our website. Now is the time to move mental health and substance use health from out of the shadows and into the light. For too long, public investments in mental health and substance use health have been far and few between. Through this news conference, our social media platforms, and website, we hope to reach as many Canadians as possible so that they sign the Parity Pledge and become actively engaged in the public policy process by strongly encouraging their Member of Parliament, and indeed all parliamentarians, to move forward and improve publicly funded access to mental health and substance use health programs, services, and supports across the country. With the momentum generated by the platform promises made by federal political parties and the support of Canadians, CAMIMH stands ready to work with all levels of government and others to identify and implement innovative and sustainable solutions that keep Canadians mentally as well as physically healthy. Our success as a country going forward depends on it. Over to you, Sally.
Merci beaucoup, Glenn et Ellen. Et rebonjour. Mon nom est Sally Guy. Je suis directrice de politique à l'Association canadienne des travailleurs sociaux. Mais évidemment, je suis ici aujourd'hui comme membre de l'Alliance canadienne pour la maladie mentale et la santé mentale. Alors, aujourd'hui, nous sommes ici pour une raison, pour demander aux Canadiens de nous aider à affirmer qu'il n'y a pas de santé sans la santé mentale. Alors, pour le faire, nous demandons à tous les Canadiens et à toutes les Canadiennes de signer la promesse de la parité. Cette promesse, cet engagement sera automatiquement envoyé à leur député fédéral pour dire 3 choses. Premièrement, que la santé mentale est importante au même titre que la santé physique, qu'il est maintenant le temps d'améliorer l'accès aux services financés par l'État, et dernièrement, que nous avons besoin de la parité entre la santé physique et la santé mentale. Mais c'est quoi la parité? Un exemple, si je me casse le bras, je sais que je vais recevoir des soins rapides et efficaces, les bons soins dans les bons délais. Mais dans le cas d'un problème de santé mentale ou de consommation de drogue, c'est une situation bien différente. Il se peut qu'il n'y a pas de service dans ma région, qu'il y a une liste d'attente de plusieurs mois ou plus, ou que je n'ai pas les moyens de payer de mon poche. Et je pense que particulièrement dans le contexte de COVID-19, nous connaissons tous quelqu'un qui a été négligé ou abandonné par le système de santé mentale au Canada. Il est évident que l'approche actuelle est dans l'impasse. Même avant la pandémie, enquête après sondage, après des enquêtes, ont tout montré que la santé mentale collective des Canadiens était en déclin. L'Institut canadien d'information sur la santé a trouvé en 2020 que 57% des Canadiens qui souhaitaient de l'aide pour leurs problèmes de santé mentale n'ont pas reçu des services. Et c'est seulement un exemple. Alors, selon nous, c'est ni juste, ni correct, ni suffisant. Bien que nous sommes ravis que le discours du trône ait promis de mettre l'accent sur la santé mentale au même titre que la santé physique, c'est maintenant le temps de donner suite à cette promesse. La sensibilisation et la lutte contre le stigma sont merveilleuses et tellement importantes, mais si nous demandons aux gens d'être courageux et de demander de l'aide, nous avons besoin d'un système assez solide, assez fort pour y répondre. Alors, il faut que le gouvernement fédéral, en partenariat avec les provinces et territoires, bien sûr, joue un rôle de leadership et prend des mesures législatives pour s'assurer que les Canadiens cherchent à se faire traiter, que les Canadiens qui cherchent à se faire traiter pour des problèmes de santé mentale ou de toxicomanie aient le même accès aux services, aux soins que les autres problèmes, les problèmes physiques. Et c'est là tout le sens de parité. Selon l'Alliance, la meilleure façon d'achever la parité est d'adopter une nouvelle loi fédérale. Nous décrivons en grand détail cette loi proposée dans notre rapport qui est intitulé « De l'ombre à lumière ». Ça a été publié en juin de cette année. C'est disponible sur notre site web. Ça comprend une recommandation pour plus d'argent, pour un transfert avec un financement prévisible. Mais ce n'est pas uniquement à propos de l'argent. Ça propose des investissements dans les déterminants sociaux de la santé et ça met en lumière l'importance de créer des standards et des indicateurs nationaux et comment les systèmes actuels pourraient être plus efficaces. Dernièrement, ou presque dernièrement, un peu plus de contexte sur pourquoi l'Alliance est bien placée pour aider le gouvernement fédéral à répondre à notre crise actuelle de santé mentale, y compris la crise des opioïdes. Alors, l'Alliance est composée de 13 organisations nationales qui représentent les deux côtés de la médaille. D'un côté, les personnes ayant une expérience vécue, et sur l'autre côté, les fournisseurs de soins de santé mentale, comme les travailleurs sociaux, comme moi. Alors, nous avons toujours ces deux perspectives-là, et c'est quelque chose que je trouve pas mal puissant. Alors, par le biais de cette conférence de presse et de nos médias sociaux, nous espérons atteindre le plus grand nombre de Canadiens afin qu'ils signent la promesse de la parité et qu'ils encouragent fortement leurs députés et en fait tous les parlementaires à améliorer l'accès aux services de santé mentale et de toxicomanie au Canada. Alors, pour signer la promesse, visitez notre site web. C'est notre acronyme en anglais, c'est CAMIMH, CAMIMH.ca, ou trouvez-nous sur Twitter ou Facebook. Et merci beaucoup. Je suis ravie des questions, and I will pass it back to you, Ellen.
Excellent.
Thanks,
Thank you very
Sally.
much.
Thanks. That concludes our formal comments. We would be pleased to take any questions that you might have.
Seeing no questions, I will thank you all for being here today. I will thank our speakers for their comments, and that will conclude our press conference for today. Thank you very much, everybody, for attending.
Thank you.
Thank you.